In 1978, Louise Brown became the world's first baby to be born by in vitro fertilization, or IVF. Her birth revolutionized the field of reproductive medicine. Given that approximately 1 in 8 heterosexual couples has difficulty conceiving, and that homosexual couples and single parents often need clinical help to make a baby, the demand for IVF has been growing. IVF is so common that more than 5 million babies have been born through this technology. IVF works by mimicking the brilliant design of sexual reproduction. In order to understand IVF, we first need to take a look at the natural process of baby making. Believe it or not, it all starts in the brain. Roughly 15 days before fertilization can happen, the anterior pituitary gland secretes follicle-stimulating hormone, FSH, which ripens a handful of follicles of the ovary that then release estrogen. Each follicle contains 1 egg, and on average, only 1 follicle becomes fully mature. As it grows and continues to release estrogen, this hormone not only helps coordinate growth and preparation of the uterus, it also communicates to the brain how well the follicle is developing. When the estrogen level is high enough, the anterior pituitary releases a surge of luteinizing hormone, LH, which triggers ovulation and causes the follicle to rupture and release the egg. Once the egg leaves the ovary, it is directed into the fallopian tube by the finger-like fimbriae. If the egg is not fertilized by sperm within 24 hours, the unfertilized egg will die, and the entire system will reset itself, preparing to create a new egg and uterine lining the following month. The egg is the largest cell in the body and is protected by a thick extracellular shell of sugar and protein called the zona pellucida. The zona thwarts the entry and fusion of more than 1 sperm, the smallest cell in the body. It takes a man 2 to 3 months to make sperm, and the process constantly renews. Each ejaculation during sexual intercourse releases more than 100 million sperm, but only 100 or so will ultimately make it to the proximity of the egg, and only 1 will successfully penetrate through the armor of the zona pellucida. Upon successful fertilization, the zygote immediately begins developing into an embryo and takes about 3 days to reach the uterus. There, it requires another 3 or so days to implant firmly into the endometrium, the inner lining of the uterus. Once implanted, the cells that are to become the placenta secrete a hormone that signals to the ovulated follicle that there is a pregnancy in the uterus. This helps rescue that follicle, now called the corpus luteum, from degenerating as it normally would do in that stage of the menstrual cycle. The corpus luteum is responsible for producing the progesterone required to maintain the pregnancy until 6 to 7 weeks of gestation, when the placenta develops and takes over until the baby is born approximately 40 weeks later. Now, how do you make a baby in a lab? In patients undergoing IVF, FSH is administered at levels that are higher than naturally occurring to cause a controlled overstimulation of the ovaries, so that they ultimately produce multiple eggs. The eggs are then retrieved just before ovulation would occur, while the woman is under anesthesia, through an aspirating needle that is guided by ultrasound. Most sperm samples are produced by masturbation. In the laboratory, the identified eggs are stripped of surrounding cells and prepared for fertilization in a petri dish. Fertilization can occur by one of 2 techniques. In the first, the eggs are incubated with thousands of sperm, and fertilization occurs naturally over a few hours. The second technique maximizes certainty of fertilization by using a needle to place a single sperm inside the egg. This is particularly useful when there is a problem with the quality of the sperm. After fertilization, embryos can be further screened for genetic suitability, frozen for later attempted pregnancies, or delivered into the woman's uterus via catheter. Common convention is to transfer the embryo 3 days after fertilization, when the embryo has 8 cells, or on day 5, when the embryo is called a blastocyst and has hundreds of cells. If the woman's eggs are of poor quality due to age or toxic exposures or have been removed due to cancer, donor eggs may be used. In the case that the intended mother has a problematic uterus or lacks one, another woman, called a gestational carrier or surrogate, can use her uterus to carry the pregnancy. To increase the odds of success, which are as high as 40% for a woman younger than 35, doctors sometimes transfer multiple embryos at once, which is why IVF results in twins and triplets more often than natural pregnancies. However, most clinics seek to minimize the chances of multiple pregnancies, as they are riskier for mothers and babies. Millions of babies, like Louise Brown, have been born from IVF and have had normal, healthy lives. The long-term health consequences of ovarian stimulation with IVF medicines are less clear, though so far, IVF seems safe for women. Because of better genetic testing, delayed childbearing, increased accessibility, and diminishing costs, it's not inconceivable that artificial baby making via IVF and related techniques could outpace natural reproduction in years to come.
Story that we have been following since 2009. After a clerical error at a fertility clinic, Carolyn and Sean Savage received devastating news. The implanted embryo growing inside Carolyn was not their child. They decided to see the pregnancy through to fulfill another couple's dream, a decision that would take their own hopes of growing their family on an unbelievable journey. Carolyn and Sean Savage are here to share some news with us, but first, their story. It began as a dream for two college sweethearts.
We knew that we would start a family right away after we got married because we wanted kids and lots of them. That was our plan.
A plan Carolyn and Sean Savage quickly put in motion. As they celebrated their one-year anniversary, the Savages welcomed their firstborn, Andrew. The first time, no problem.
No problem. I carried him full term, so we thought we were in the clear.
But they weren't. Because of Carolyn's medical history, growing their family proved difficult. Their second, Ryan, was born premature. 10 years and 4 miscarriages later, their daughter Mary Kate arrived through in vitro fertilization.
And it was just such a miracle, a huge accomplishment for us.
A family full of love, but a promise still to fulfill.
But Sean and I had discussed before we underwent our very first IVF that we would give every embryo we created a chance at life.
In February 2009, they did just that. Carolyn returned to the same clinic to have some of the remaining embryos implanted. 10 days later, a devastating phone call. Carolyn was pregnant, but with another couple's child.
They transferred the wrong embryos.
It was just a stunning, stunning moment.
Yeah, what's going through your mind at that point?
There's a baby growing in me. It's somebody else's. What are we going to do?
The answer to that difficult question came remarkably easy.
We knew that we had somebody's very, very wanted child. I just couldn't see taking that away from another mother. There's just no way.
Despite the risk to Carolyn's health and that this would be her last chance to carry a baby, the Savages moved forward with the pregnancy, but looked again to modern medicine for help with their remaining embryos, and found themselves pregnant through a surrogate named Jennifer.
I had to do it for Carolyn and Sean.
And we were very, very happy.
That September, Carolyn gave birth to a baby boy named Logan. The Savages left the hospital empty-handed, but hopeful about their impending bundle. A week later, yet another crushing call. Jennifer miscarried.
I'm kind of looking up at the heavens going, seriously? Have we not done enough?
In February, Carolyn and Sean talked on Today about their journey. Despite all their pain, they count their blessings, but continue to keep faith in their dreams.
We're not giving up, and so as we look forward, we'd certainly welcome more children if that was something that would
We're
come
leaving
about.
our options open.
Carolyn and Sean Savage are with us along with their surrogate Jennifer Onash. The Savages are the authors of Inconceivable, A Medical Mistake, The Baby We Couldn't Keep, and Our Choice to Deliver, and The Ultimate Gift. Good morning to all of you.
Hi, Meredith.
Good morning.
Hi. Before we get to the news, you have been through so much, as that piece clearly portrayed back in 2009, 8 days after Logan was born and you gave him to his parents, his biological parents. Jennifer, who was carrying your child as a surrogate, miscarried.
Right.
And yet you decided then you were not going to stop, you were going to keep trying. You actually harvested more embryos. Why? Why, Sean? Why did you want to keep going?
We're not ones that give up, and
That's for sure.
we always wanted to expand our family, and we always kept hope.
Yeah, I think it was just, I think we were looking for that moment when I think all families have to decide when they're done. It's a personal decision. We just didn't have it yet, so we thought we'd try again.
And you tried several times, and you pretty much had given up, right?
I had. We tried 3 times in 2010, and by the 3rd time, I was like, forget it.
You didn't want them to go in and retrieve any
I didn't
eggs.
want to do any more. And these two were very encouraging, and we had already paid and planned for that 3rd retrieval, and so I thought, okay. They were both like, just do it, and they switched our protocol, and voila, we hit the jackpot.
And I want you to break the news to the audience. You really did hit the jackpot.
We did. As our doctor said, Dr. Sher, he said, we hit it out of the ballpark. So we're expecting twins.
Twins.
This upcoming
Wow.
summer, yeah.
What was your reaction when Jennifer, so you must have told them, right? You told them it was twins?
Yes.
Yeah.
Very exciting, which we kind of had an idea that it possibly was, so.
Yeah, she said everything was really different this time. So she gave us a call, and right before Christmas, it was the best Christmas present ever. So we kind of just, we were excited, but then you hold it in, and then the worry starts. And right around the beginning of January, we found out it was twins, and that moment was, oh my goodness. Oh my goodness.
It's the best news. Jennifer, how are you feeling?
I'm feeling good. A little bit tired, but that's to be expected.
Yeah, and the baby's due to be delivered sometime in August at this point, yeah. Do we know boy, girl, or?
Not yet.
And if you're going to find out enough.
Oh, we're done with surprises.
You're done. You don't want to know? Okay.
We want to know as soon as we can. Yeah.
And what role do you want Jennifer to play in the baby's lives? Do you know?
You know, Jennifer, we're so lucky to have her in our lives, and I can't imagine after these babies come to us, she'll always be a very, very special part of our lives, and I want them to know her, and not just because you brought them into this world, but because she's such an amazing person. And I think for children, as many people who can be terrific role models for them, and for as many people that love them, the more people that love kids, the better.
And why did you stick with this family, Jen?
They deserve it. I mean, I can't think of any better people that deserve this. I've met a lot of people through trying to be a surrogate, and they have really touched my heart.
And you've touched a lot of people's heart. I have to ask you before we let you go, little Logan, have you seen him recently? Are you going to see him soon?
We're hoping to see him sometime in the spring.
Yeah, we're hoping, and we know he's doing well. Our love for him will always be there, and any opportunity we have to be part of his life, we will. And just faith, hope, and love, that's where we're at right now.
And I'm looking
it's
at
so
your
exciting.
eyes filled with tears. Where are they coming from?
It's just excitement. It's it's for what Jennifer's doing. It's for us. I mean, how thankful we are for this gift. It's unbelievable.
Will you come back and bring the babies, right?
Oh, yeah.
Yeah, they have a place right here. We got little T-shirts and diapers and the whole thing.
Awesome.
Thank you so much.
Thank you.
Great to
Thank
see
you.
you all.
Thank you.
Thank you.
Appreciate it.